This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Okay, good morning everyone. We'll do a quick one, orthopedic injuries, so wrist injuries specifically. So what are some important things that we kind of ask when we talk to a patient about an injury they just sustained to their wrist? Neurovascular exam distally, mechanism of injury, are they right or left-handed, which hand is injured, what do they do for a living, right? Because if it's a violinist or a piano player, that their wrist injury might be of bigger consequence to them than to somebody who doesn't do that. Any other things that we want to know about? So specifically where it hurts, right? So there's a lot of different parts to the wrist, right? The distal, radius, and ulna go into the wrist, and then there are all of the carpal bones in the wrist, and then there are the metacarpals, the bones across the middle of the hand, and then the phalanges are the fingers, okay? So this is a specific study related to the wrist, and particularly a type of injury that is oftentimes hard to diagnose. So this is a study that came out of the Emergency Medicine Journal in 2023, just in May, about an occult injury that we oftentimes tell patients, well, we don't see this on x-ray real well, so if you're having persistent pain, we need you to follow up. Any idea what injury that might be? It's kind of two of them that we worry about. So in the carpal bones, there's a bone called the scaphoid, and it's right here kind of on the thumb side. We'll maybe put some pictures in with the link to the podcast. But so there, because of the way the x-ray works and the penetration of x-rays and in the setting of acute trauma, there's oftentimes a lot of swelling, which doesn't give you the best picture. So what we try to do is we try and look at their hand and do a very detailed exam of the wrist to see if we think we're worried that there's a scaphoid fracture. And that bone is right in here. And so we'll ask them to do things like we'll push right here. Anybody know what this part is called?
Snuffbox fracture.
Yeah, the anatomic snuffbox. Well done, Tracy. And so we'll say there's no tenderness of the anatomic snuffbox, which is right in here. We'll also we'll deviate their hand to the ulnar side to kind of open up that area to see if there's any tenderness. We'll test their strength against supination, which is moving the hand like this. And we think that we can do all of these things to try and say, well, we don't think there's a scaphoid fracture because the x-ray is negative and all these tests were negative. And they did this big retrospective study of about just over almost 1,700 patients. And they looked back and unfortunately, none of those individual tests we do definitively rule out scaphoid fractures. They can make them less likely, and each of them has kind of statistics that go with that, but it doesn't rule out a scaphoid fracture. And so the important lesson to take from this, and it's good to tell patients this before they leave, is and this is true really for radiographs for any acute injury, the sensitivity of plain films in the setting of acute injury is generally very low. So grossly displaced and open fractures and those, sure, we're confident we can see those, but non-displaced or hairline fractures, whether they're in the wrist or the knee, each joint has its own kind of characteristics, but generally speaking, the sensitivity of those is very low unless it's a displaced fracture, comminuted fracture. So what we should tell patients is, look, we're going to either splint you, and each joint you do differently, but we'll probably send you home in a splint, and it's really important that you follow up. And it's not just to protect ourselves, it's truly that fracture may not show up unless you do an MRI, or it may not show up unless you repeat radiographs within a week, and that's just to make sure that there's an evidence of an occult fracture. So that's just really good instructions to give all of our patients, and it's something that it seems like, based on this study, we should probably do for all of our wrist injuries.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.